everyone. Thank you for joining us. Today we're going to talk about something important, dental health. It's something that matters to all of us. I'm Shai and I'm excited to be your host for this live show. We've got a great show lined up for you. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry and how to keep our teeth healthy and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in Dallas-Fort Worth area and Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone. And now let's welcome Dr. V and start our show.
You didn't do that. Yeah, thank you. Awesome. Hi everyone. I'm Dr. Kumar Vadivel, but you guys can call me Dr. V as most of my patients do. I'm really excited to be here with you all today. Another great episode we are looking for. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bone that surround your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology. That's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists and we have 4 offices in the Dallas-Fort Worth Metroplex. We are all about making sure your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have. You want to hear about your teeth or gums. You can ask questions live here right now. Or even send them in for our next show. And we got a bunch of them lined up. And your questions help us make these shows really helpful, not just for you, just for everyone, just around the globe. And one more thing, if you like what you are hearing or learning here, and please let us know. And your feedback is super important for us. And don't forget to subscribe or like our channel, so you won't miss out on the latest and the greatest updates and helpful tips for your dental health. I'm looking forward to talking with you all today, answering as many questions as you might have, and let's make our smiles as best they can be, right? Let's get started.
Absolutely.
Okay,
no further ado. First question, doctor, is it still possible to get a molar implant if my tooth was extracted 3 years ago?
Absolutely. Whether it is 3 years or 30 years, it does not matter. Whenever you come in for a consultation for a dental implant, what we normally do is we look in the mouth and then also what we call it as a clinical exam. And also in addition to that, we do what we call it as a CBCT or a CAT scan. That is going to exactly tell us how much of bone you have. And then depending on whether you have the ideal bone or maybe even a little bit of a compromised bone, we should be able to place the implant as soon as we can, or sometime when you have a totally compromised bone, and if we find out after the clinical and the radiological exam, then we can even make you a candidate and by doing what we call it as a bone grafting. So if it has been 3 years only, and if it is a straightforward extraction, more than likely it should be a pretty straightforward and straight shot placing the implant. Maybe do a little bit of bone grafting at the same time you place the implant. So the bottom line answer is go check with your dentist or the periodontist or the oral surgeon who's going to be placing the implant, whether you're a right candidate for implants or not.
That's right. Go and get that implant, buddy. Alrighty, Dr. V, can my sleep apnea condition increase my risk for gum disease?
The short answer is absolutely yes. There are not just the sleep apnea. There is a variety of inflammatory conditions, and we have in my class that I teach, like there are, like even to the dentist, sometimes I do teach a lot of class to my referring dentist, even to let them be aware, we got a variety of diseases. I have a list of about 60 diseases. Those are inflammatory diseases. They're all connected. So sleep apnea is one of them, which is an inflammatory disease. And the gum disease is another one of them, which is an inflammatory disease. So any inflammatory diseases are connected. For example, sleep apnea can worsen your gum disease, or your gum disease can worsen your sleep apnea. It is a two-way street. One of the common things what we see in sleep apnea patients is they kind of sometimes or most of the time breathe through their mouth, and when they breathe through the mouth or when they snore, and it causes dryness in the mouth. So when you have dryness, and that cannot flush all the bacteria that are supposed to be in the mouth, and when it does not, the body does not flush the bacteria tend to stay. Now they cause more inflammation and then more gum disease, and because your mouth is dry, and now you're more prone for inflammation and more prone for gum disease also. Again, the bottom line is whether if you have sleep apnea, then you need to check with your dentist what is your inflammatory status of your gums, and whether you need extra gum treatment as opposed to a patient who does not have sleep apnea. And then one of the most common things that I recommend for those patients is, if a regular patient gets their what we call it as scaling into planing or a deep gum therapy gets done every 3 to 5 years, you may be in the shorter end of the spectrum. You will need to have the deep gum therapy done maybe every 2 to 3 years. And if a regular patient is getting a regular maintenance cleaning done every 6 months, then you having particularly either gum disease or you're more prone for gum disease. My recommendation is you get the cleanings done every 3 months, not every 6 months. So inflammation needs more TLC, tender loving care. Check with your dentist and make sure that the sleep apnea is corrected as well as your gum disease is corrected.
Perfect. All right. Doc, is sedation covered by dental insurance, or will there be an out-of-pocket cost?
The short answer is absolutely yes. The sedation is covered by the dental insurance, or sometimes even medical insurance as well. How do we find out? Then there are some common procedures that we know absolutely is a straight shot, and they are going to be covering the sedation for the most part. For example, one of the most common procedures that we do in our office here is removing all 4 wisdom teeth at the same time. It's a pretty slam dunk, no questions asked, almost not foolproof, almost no questions asked, and then most insurances pay for that. But other procedures, even removing multiple teeth, or patients are getting full mouth gum surgery done in our office, or patients are getting a bone grafting done for implant placement, or getting multiple teeth extracted and implants placed at the same time. Those things we need to call the insurance and find out whether the insurance is going to pay for it. So this is typically what happens whenever you go for a visit to your dental office, whether you are a candidate for wisdom teeth removal or gum surgery or implants or even any other dental procedures. We always do like an insurance check. So we either check it with your insurance company, either checking via the portal, or we are going to call them to find out whether the procedure is covered by the IV sedation is covered through your dental insurance, and whichever dental office that you're going to be visiting with, and they should be able to tell you whether this procedure, IV sedation, is going to be covered or not. And that's number one. Number two, even if it is not covered, it's relatively it is going to be less expensive, and the goal is to make sure that you're comfortable during the procedure. So you should be able to work with the dental office, and what is the cost is if it is not covered. It could be anywhere between $400 to maybe up to $8,800 or $1,000, depending on the amount of time it is going to require to complete a specific procedure. Again, check with your dentist whether they have insurance coverage, whether you have insurance coverage, or number two, if you're not going to have, coverage for the procedure, for the IV sedation, what is the cost going to be, then they should be able to work with you on that.
Absolutely. Doctor, can wearing braces lead to TMJ problems later on? Good question.
Absolutely. The answer is yes. The answer is yes, but I'm not going to say every single patient who is going to have braces is going to have a TMJ problem. TMJ means, we call it as a temporomandibular joint. So it's kind of like, a chicken or the egg, right? Which came first, right? For example, one of the main reasons why you're going to get the braces treatment is because you got some misalignment of your teeth. Sometimes it could be a misalignment of your jaw. For example, you could be all the way sticking forward, or your top jaw may be sticking all the way outward. Sometimes you got a buck teeth, or sometimes you have the lower jaw going all the way to the back and your chin is kind of protruding like that. So if it is happening, then you are going to end up getting braces to align the teeth together. So now, let's say if you didn't have braces, and because of the misalignment in the jaw or the teeth, would that have led into the TMJ? Absolutely, the answer is yes. Now, if you did braces and you got the teeth aligned properly or close to ideal, now you're going to think that, oh, the braces caused the TMJ problem, right? So, irrespective of whether you're going to have braces or not, you are going to have, or you are going to be at a risk of having the TMJ issue. But can the braces worsen it? It depends on the case, really. So, I wish I could really give you a straightforward answer. Oh yeah, TMJ is caused by the braces, but I can't really give you an answer. It depends on case by case. But either the misalignment of your teeth or the braces can increase the risk of the TMJ problem, is what I could say.
That's right. Go and see your provider.
You got it. Yeah. Talk to the orthodontist and then see how much of a risk you are in to have the TMJ problem.
That's right. Okay, so we'll keep the ball rolling. You guys definitely don't hesitate to post questions in the comments. Doctor, doctor, what is the purpose of the back end of a dental floss handle? Very specific. Wow.
So what the person is talking about is not like the regular floss. The regular floss is like a complete thread, the complete thread, and there is no handle to it. What the person is talking about is, what they call it as a floss pick. So if you go to the store, when you walk down the aisle to look at all the oral hygiene products, your favorite your departmental store or the drugstore carry, so you're going to have something called, what we call it as a floss pick. So the floss pick is that is the one that has the end to it, right? And then also you have a floss on the other end. So the one end of it, just like this, and you have a floss like that, and then the other one, it's just going to stick out and it is going to have a pick, like a toothpick kind. So that is why we call it as a floss pick. So what generally people do is to use that because they don't have the dexterity or the patience to be able to do the regular flossing, and they use that toothpick to go in between the teeth. And when you have a really big gaps in between the teeth, sometimes the floss cannot get to it, or sometimes you have a big chunk of food, and if you're not maneuvering the floss properly, which is easier to do on the manual flossing, the thread, you can maneuver it, as opposed to the floss pick, you cannot maneuver it around because you don't have a lot of wiggle room. So in that case, people use the other end to take the bigger chunk of the food out. Just last night it happened to me, right? I could not find the floss in my bathroom, and so I just found a floss pick. So I used the floss pick to go in between the teeth, and then I have a small, a slightly bigger gap on one of my tooth here. So I had to use the floss pick just for the same exact reason I told you. One of the bigger piece of food, I was actually eating fish last night. Oh, thank you to my wonderful wife, who made.
Thank you for feeding him pseudo.
Yeah, she made fish for me last night, and then a bigger piece of fish got stuck in between the tooth. between the teeth, and I had to pick the piece of fish. So I did that, and
Came out.
it came out.
Oh,
Yeah,
very
yeah.
nice.
So, to the bottom line answer is, so when you are using a floss pick, so you use the one end to go in between the teeth, and then the other end on the top of the tooth if you have a piece of food getting stuck. Okay.
All right, to all my floss pick warriors, I am with you. Floss pick too. Alrighty, doctor, is it okay to get veneers at 30 if my teeth are healthy, but I just prefer the look of veneers over my natural teeth?
Whether you are 30 or whether you are 80, it doesn't matter. Whether you are an ideal candidate for veneers or not, you need to check with your dentist. So, what are veneers? So if you are concerned about the way that your teeth look, then you want to have some kind of a cosmetic work done. That's what the veneers are for. So whenever you want, so as I said, age is no bar for getting the veneers. So the question is whether you have some existing what we call it as an erosion or some kind of a wear on your teeth, and whether you are a good candidate for veneers or not, whether you have good length of teeth, and whether you are a candidate for veneers, and whether you grind your teeth. All of those things need to, whether you have cavities also, sorry I mentioned that. So all of those things need to be evaluated before your dentist tells you whether you are a candidate for veneers or not. So depending on the status or depending on the condition of your teeth, now the dentist will be able to tell you how much of a preparation need to be done. Sometimes we call it as a prepless veneers. What that means is if you have absolutely perfect teeth and you are just concerned about the cosmetic, it's almost like no preparation, because a lot of times whenever a veneer needs to be done, we got to shave off some of the teeth to be able to put the veneer. So what prepless veneers mean is you can, almost like a no preparation. It's almost kind of sanding down the teeth and putting a facing over up on the top, just like nails, right? You want to show them? Yeah. Your nail? There we go, right? Yeah, so it's almost like that. So you put like a facing over your existing teeth. That's what the prepless veneers are. So sometimes you may have to do a little bit of a preparation, but if you have a condition, you have advanced decay or you grind your teeth and all of that, you may need to get a crown. So the answer is talk to your dentist or your cosmetic dentist, or come see us at the ToothHQ locations, and we'll be happy to evaluate your teeth and let you know.
That's right. Okay, so we're going to take a break from the questions that were sent in and jump into our comments. First live question. My gums bleed every time I floss, but they don't hurt. Is this a sign of gum disease?
So the gums bleed when you floss your teeth. Absolutely. Is it a sign of gum disease? Absolutely, it can be. So depending on how good of like a person in visiting for a professional cleaning, that will answer your question, or whether your dentist has talked to you about whether you have gum disease or not. So if you, let's say for example, we typically recommend we do patients get a deep cleaning done every 3 to 5 years or 2 to 3 years if they have history of gum disease, and you did the deep cleaning, and then you go for your routine maintenance cleanings every 3 months, and in between when you do that, when you go home and when you floss, and if the gums bleed, I wouldn't be too much concerned about that, because you're kind of sticking with your professional maintenance cleanings for your deep gum therapy or the scaling and root planing, and your maintenance cleanings every 3 months, and you don't have to worry. But if you have not seen a dentist for a long time, and if your gums continue to bleed when you floss, then you should absolutely be seeing a dentist to check your gums out, because you don't want to find out. Matter of fact, if you recall, when we were teaching the class on Tuesday, right? We were talking about gum disease is a silent killer, and gum disease does not hurt. So you don't want to be like, yeah.
All the time.
All the time, right? Unless it is kind of really advanced, or when you have a piece of food, or like some tartar gets stuck under the gum line, so it does not hurt. So you don't want to find out late that, oh, sorry, we can't save your teeth. So your gums bleed, it is an absolute early sign for gum disease. Go see your dentist or your periodontist, and if you're in the Dallas-Fort Worth area,
come see us.
You got it. Thank you.
Absolutely. Okay, so you guys keep posting your questions, and we'll answer them as we go on. Doctor, can Sensodyne be used as a daily toothpaste without a dentist's recommendation?
Absolutely, yes. The answer is Sensodyne is an over-the-counter toothpaste, particularly designed for people with sensitive teeth. And the FDA will not let the toothpaste to be sitting over the counter if it is not safe. So it is absolutely safe for you to use it. Real stories happen in my office, right? So we had done today. I saw this patient for routine cleaning. This patient had advanced gum disease, and he needed to have some laser gum surgery done. So I did this gum surgery maybe almost like about a year and a half ago, and he's been consistently coming back every 3 months for his cleaning, and he has been complaining of sensitivity because it's not uncommon for any time you have any type of deep cleaning or a laser gum surgery, because your teeth kind of get exposed, and it's not uncommon for you to have some kind of a sensitivity. So this patient has been complaining of sensitivity, and we've been telling him, hey, you can use the Sensodyne over the counter, and he's been using them consistently. Almost like when I saw him, he's almost to a stage now that all the sensitivity is completely gone. So even after patients are getting gum surgery done or a deep cleaning done, we give them for like a therapeutic reason, for a medical reason. So if you have sensitive gums, as long as you have checked it out with your dentist, whether for you have gum disease or you have cavities, and if they confirmed everything and you don't have gum disease or you don't have cavities and you are a regular attender for your dentist, then can you use Sensodyne? Absolutely, go for it.
That's right. I use Sensodyne on a daily.
Good, very good.
Alrighty, doctor, is it a good idea to place a bridge over my crooked front teeth to improve my smile?
Absolutely, the answer is yes. But it depends, right? If your teeth are completely crooked, and can you fix it with the bridge? Only a dentist can answer that question. So what happens is, like, if you have a little bit of crookedness, can we prep your teeth? For example, whenever you needed to have a bridge, you cannot put a bridge just over a tooth. If this is your tooth, we got to grind your teeth down to be able to put a crown on this side and then a missing spare, and then there is another tooth here, grind the tooth on that side, and then put another one, right? So if you have complete crookedness, then when you prep the teeth, then if you have accidentally, if the nerve gets exposed, then it is very possible that you may not be a good candidate for braces, putting in braces. And whenever you go to a dentist, then the dentist is going to give you all the risk of, okay, hey, well, your teeth are too much crooked and too much rotated. If I end up doing a preparation, you may end up exposing a nerve, and you may not be a good candidate for the bridge. But if there is a little bit of a misalignment, of a bit of a rotation, can you prep the teeth to get the bridge? Absolutely, you can go for it. But there are better alternatives available than doing that. The best option would be you can have like a limited braces to rotate those teeth, to avoid like having to have a root canal, or even better, once you rotate those teeth, you can get a dental implant, which will be an easier fix, so you don't even have to touch those adjacent teeth. So there are multiple options. Talk to your dentist, and they should be able to help you.
I don't think they have a tooth missing.
Improve bridge. Yeah, bridges are usually good idea to place a bridge over my crooked teeth. Well, I assume that because they said a bridge, like somebody would have talked to them about a bridge to replace that. So it is very possible. That's a great point, right? So you don't want to place a bridge over two natural teeth adjacent together. You don't want to really do that. Yeah. But if what you are saying is if they don't have a missing tooth, then if the teeth are really crooked, then They are going to still prep the tooth, and then they're still going to put an individual prep. Just from them saying they're bridged, like I assume that they have a missing tooth. So irrespective, again, check with the dentist. Yeah.
Absolutely. All right. They could have just Googled that.
Yeah.
Okay. Doctor, is the pinhole surgical technique a good alternative to traditional gum grafting for my gum recession?
Absolutely. The pinhole technique is a great technique. Pinhole technique is a form of a gum grafting. We've been traditionally doing gum grafting for 50 or 100 years. We have been doing that, and I personally have been doing gum grafting for the last about 25 years. So pinhole is a form of a technique. We live in the modern age now. Everything is kind of non-invasive, or minimally invasive. The gum therapy that we do, in our office, instead of doing a traditional gum surgery, we do laser gum surgery. We don't have to rip the gum tissue open. Same thing whenever we have gum grafting to be done, instead of completely opening up the gum tissue, we do a minimally invasive pinhole technique is what we do, and that is a form of a gum grafting. Whether you are a candidate for a pinhole technique or a traditional gum surgery, or like a combination of both, like what we call it as a tunneling technique on the gum grafting, your periodontist should be able to tell you. So the answer is anybody could be a candidate for a pinhole technique, and whether you are a good candidate for that or not, talk to your periodontist, and then they should be able to tell you.
That's right. I don't see a lot of offices doing pinhole anymore.
Yeah, it is not. It used to be like a very, very popular technique, and then now I don't see like a lot of people, but there are a lot of people that they do like not exactly the pinhole technique, but it is a variation of that. Like I said, they may be not calling it as a pinhole, and they may be calling it as a minimally invasive procedure, or what we call it as a tunneling technique. It's basically, the pinhole is a variation of what we call it as a tunneling technique, which we've been traditionally doing. It's a name for it. But there are some dentists that traditionally are exclusively trained for those pinhole procedure, and they make sure you're talking to them to understand the difference between the pinhole technique and the tunneling technique, and what kind of the condition that you have, and then they should be able to tell you based on that.
I typically see patients coming in specifically asking for it, not necessarily knowing what it is.
But we can explain to them when they come. Absolutely, you're right. Yeah.
Okay, so we'll jump into a fun game that I believe you lost 2 times in a row.
Oh man.
Yeah.
I thought you told me I won last time. No? Okay, all right. I'm going to try, man. I'm really going to try this time.
All right, so we're going to play rapid fire. I'm going to ask Dr. Vadivel a question. He has to answer it in 1 to 2 sentences.
Okay, all right.
All right, are you ready?
So are you saying like I can't be like a...
Going on and on and on.
Okay, all right, man. Okay.
All right.
Okay.
Okay. What are 5 common causes of bad breath?
Gum disease, food, not visiting your dentist, not doing proper brush and flossing, and you got cavities.
Okay.
Fine.
Another one instead of cavities. Another one.
Another one instead of cavities could be loose teeth. Or it could be like some kind of a GI problems.
Okay,
Yeah.
I'll accept that one.
Like
All right.
an intestinal problem. That's what I mean. Yeah.
Acid reflux?
Acid reflux. Yeah.
Okay. What are the 4 signs that gum disease is getting better?
No bleeding on your gums, and you don't have any bleeding on your gums, and then you don't have bad breath, and the teeth used to be loose, and now they are not like loose anymore, and you have you are able to sleep better, and even like you don't have to worry about the teeth, and the dentist is telling you like your gums look great, and then you think that it's not like puffy or swollen anymore, and they look better.
Okay, very nice. I think that was like 10 sentences, but
Oh,
okay.
man,
I was
man.
distracted, so we'll
Okay.
let that one slide. All right. What are 3 misconceptions about dental implants?
They are painful, they don't look natural, or you're not a good candidate for dental implants.
Well, some people aren't.
Hmm?
Some people aren't.
No, not always. Like I very rarely say that they are not a good candidate. But
true.
they think that they are they think that they are not a good candidate. But remember, we say like we do bone grafting,
Yeah.
and then we find alternative places to place the implants. Yeah,
Yep.
yeah.
Mm-hmm.
Okay.
Absolutely. What are 2 common dental emergencies you should never ignore?
When the tooth gets knocked out, or when you have like a dental abscess, or when you have like a really loose teeth.
2.
Two. Okay. Oh, sorry. Okay, two.
All right. Before a dental procedure, what's the number 1 thing you should tell your dentist?
Make sure you tell the dentist everything about your medical health.
Yeah, like you do drugs.
Mm-hmm. One of them for sure.
Absolutely.
Right. Yeah. But anything and everything about your medical health. Like a lot of times, as a surgical office here, I finish my one sentence, okay, but I'm telling them a story now, okay?
Yeah,
Telling
totally
them a
lost. Go
story,
for it.
okay.
No, go for it, but you lost.
I'm telling them a story.
You're forfeiting the game.
Yeah.
Okay.
No, the game is over. I'm kind of sidetracking from the game. How about a new question there? How about, what
Okay.
can you not hide? Can you ask the question, what can you not hide to a dentist about your health? That's not in the question there.
Oh, okay. What
Yeah.
should you not hide from your dentist
There we
about your
go.
health?
There we go. Yeah, right. So, why? How about you rephrase it? Why should you not hide? Why should you not hide?
Why should you not hide certain things from your dentist?
Okay, for example, the medical history, right? So, one of the common things that we do in our office is surgical procedure, or every single patient comes to our office and gets surgical procedure done. And after surgery, like patients can bleed. And if you do not disclose to us, like surgeons, oh, you take certain blood thinners, and particularly kind of like a really strong blood thinners. For example, when patients have stroke, or when the patient have certain medical conditions, or atrial fibrillation, your heart beats really fast, they take some really strong blood thinners. And when you do not tell them, not that you are going to hide, you forget even, right? And it is not good for you because you can bleed to death. Even aspirin, like a little tiny aspirin, you need to tell them. So then, as surgeons, we can take precautions, when we do the procedure. So that's why you do not
Hide certain stuff.
Yeah, right, exactly. Yeah, particularly about your health or the medication that you're taking.
I just thought about something.
Okay.
Alrighty. Doctor, at the age 40, is it normal for teeth to feel loose, or could this be a sign of something serious?
The at age 40, it doesn't matter what your age is. If your teeth are loose, it definitely is serious, and it could be a sign of gum disease, or it could be a sign of a bad bite, or it could be a sign of that you possibly had some braces in the past, and that kind of made your condition worse, and the teeth are feeling loose. No matter what it is, no matter what the age is, and the teeth should not feel loose unless you've been seeing your dentist on a very regular basis, or you are seeing your periodontist on a very regular basis. They told you, hey, I see your teeth are slightly mobile, and it is completely okay. We keep monitoring, because that is what we do exactly. Anytime you come, we measure how your the mobility is, or how much, whether it is changed or not, and then we make the recommendation. So do not ignore. Go see your dentist or the periodontist. Yeah.
What if you're like 8?
What if you're 8? If it is a baby tooth, yeah, you don't have to worry about it, and then it is just going to come in a wiggle, and then it is going to wiggle, and it's just going to come out. But what if you're 8 and if you have a permanent tooth that is loose?
That is quite questionable.
Right? Yeah. So you can't ignore. So how about if we rephrase that? At age 40, I'm expecting that they have all permanent teeth, right?
We see baby teeth in adults all the time.
For the most part, let's say that, right? Yeah, right? So if your baby teeth feel loose, possibly like not a big deal that they are going to come out. Unless you are an adult, you still retain some baby teeth, then you don't want to go have like a snaggle tooth with the baby tooth missing even. But at age like if you're younger, then if you have a permanent tooth missing, permanent tooth wiggly, then you need to see, and any tooth wiggly, unless your dentist tells you otherwise, you need to be talking to your dentist or the periodontist.
All right. Perfect. Doctor, is it common for wisdom teeth to break or chip, and could it have been prevented?
Absolutely. The answer is wisdom teeth are one of the most common teeth that you are not able to keep it clean because they are so far back, and that's one of the main reasons why we do treatment for the wisdom teeth, which is one of the most common thing that we do is we remove wisdom teeth for the most part. So the reason they chip is because, like I said, because they are the last tooth in the mouth, far back tooth. You can't keep them clean, and then even if you are an avid flosser, then because there is a flap of gum sitting on the top of the wisdom tooth, sometimes you cannot keep them clean or brush them, or even there is no way you can floss them. And so at that point what happens is, unless the teeth are kind of fully erupted in the mouth, then you are going to, irrespective of that, you are going to chip the tooth. So when the tooth chips, what is the most common procedure we do in this country is to remove them. There are some parts of the world I've seen, they try to fill the wisdom teeth, which is not a common thing that we do here. But can the wisdom teeth be filled? Yes, they can be. In this country, we don't do that. However, the only time we do that is the tooth is completely fully erupted and patient is like older and they've always kept the teeth, mint, for a long time, and then they have a small cavity and it chipped. Can we fill that? At that point, yes, they can. Yeah.
Okay. Very nice. Can TMJ problems also cause dental issues like gum recession or loose teeth from jaw stress?
Absolutely. The answer is yes. The TMJ problems can lead to a bad bite, and or you constantly grinding or clenching your teeth. The teeth can go loose, and not only that, but also because you constantly keep doing that, when you put a lot of pressure, your jaw is designed by Mother Nature to be slightly away. For example, when you do that, the teeth come in contact, but your teeth are not supposed to be in contact. For example, when I'm talking now, my teeth are not coming into contact. When I'm just relaxing, my teeth are supposed to be like this. They're not touching together. But when you grind, when you're doing this, always doing that, imagine like putting your teeth together and talking. So that's what you're doing. So when you're putting in a lot of pressure, the tooth that you see outside in the mouth, and then you see the gum line there, and that's where the tooth and the root kind of meet, and that is like that is kind of like the junction between the crown and the root. That's where when the gums are attaching, and now because you put constant pressure, now the gum tissue is going to start to pull away from the junction of the tooth and the root. So that is what you see, like the gum recession, and that is when you start to see the gums kind of getting loose. So TMJ absolutely can put pressure on the teeth and make your teeth loose, and also cause gum receding.
Okay, definitely get an eye guard.
Get an eye guard, absolutely. Well, yeah, thank you. Yeah, so
Dr. Shai, absolutely.
Dr. Shai, thank you. Yeah, so what do you do for that? What Shai said, gum grafting to fix the gum receding, and then okay, Dr. V and Shai, how about that? Okay, yeah. All right. So gum grafting.
Dr. V and Shai?
No, Dr. V and Dr. Shai.
I think it's Dr. Shai and Dr.
Dr. Shai and Dr. V. How about that? Yeah. Okay. So gum grafting to fix the gum receding, and the night guard to prevent you from grinding your teeth.
I think Dr. V is forgetting something as well.
Okay.
I think he's forgetting something.
What is that?
What else would you do?
On what? On the gum grafting.
Yeah.
You mean the laser you're talking about? What are you talking
What
about?
would you do before the night guard?
The occlusal adjustment?
Oh, interesting.
Oh.
Oh,
Okay, all
who's
right.
the doctor here?
Well, okay, all right. Okay, thank you. Thank you.
Absolutely.
Yeah.
Yeah.
All right.
Yeah.
Thank you, Dr. Shai.
Very welcome.
Yeah.
Yeah. Alrighty. Did you want to expand? No? Okay. Alrighty. So we're going to jump into our live questions. Keep sending them in. We'll try to do another one before the end of the live. I've been using a whitening toothpaste, but now my teeth feel very sensitive. Could it be the toothpaste?
Sorry, repeat that question.
I've been using a whitening toothpaste, but now my teeth feel very sensitive. Could it be the toothpaste? The answer is yes.
The answer is yes. The reason the whitening toothpaste could cause sensitivity is because depending on the type of toothpaste, when you are going to walk in your department store aisle, you're going to find out, there is this a whitening toothpaste, there is a starter control, there is this another toothpaste, there are zillions of toothpaste you're going to see, depending on what is on the toothpaste. For example, if you have like a lot of baking soda, then it is going to make your teeth really sensitive, and it is going to help you whiten your teeth, of course, because the baking soda is really good on whitening. But at the same time, if you use too much of it, then it is going to cause sensitivity. There are so many toothpaste. If you go to eBay or Amazon or online, and if you type in, there are so many toothpaste available. I have patients come in with a bunch of information they read it online or on TikTok, right? Yeah. And they ask me, oh, can I use this charcoal toothpaste? And what they do is, by using this charcoal toothpaste, and when they're brushing, they are grinding the heck out of their teeth, because those are like a lot of abrasives on the teeth, and they're going to completely erode the teeth away or the enamel away. When you erode or completely to take the coating of the enamel away, it is going to cause sensitivity. So the bottom line answer is yes, the toothpaste can cause sensitivity, particularly if you think that it is whitening, which is going to have a lot of abrasive.
Are you missing something?
What do you mean? Why are you picking on me tonight?
I'm just expanding.
Okay,
I'm just expanding.
All right, go ahead. Yeah. Yeah, go ahead.
What if you have cavities?
What if you have cavities?
You're
Absolutely.
not going to routine checkups.
Yeah.
You're just whitening.
Absolutely, yeah. You can do that too. So whitening toothpaste can cause your cavity without them.
Well, no, if you have cavities.
If you have cavities and if you're whitening, absolutely, it can worsen your sensitivity. Yeah. Mm-hmm. So it may not be like a real sensitive, but at that point it could become really pain. Mm-hmm. Not hot or cold sensitive. Yeah. Now it is kind of pain sensitive.
Yep. Yeah. Air hits it and it hurts.
Yeah. Mm-hmm. Good point, though.
Absolutely.
Yeah, good point. Yeah.
That's what I'm here for.
Yeah. There we go. Yeah.
Okay. So before we jump into another live question, doctor, what causes gum disease to suddenly worsen and lead to rapid swelling?
Well, we've been talking all night long about gum disease here. Gum disease is a silent killer, and you don't know when it is going to just almost explode. For example, your body has like a lot of threshold, right? So whenever you may have gum disease for a long time, suddenly your body just decides to give up. Now you got all of a sudden, you got some like real pain and real swelling, and that is going to give you some pain. And for example, one of the most common things that happen in gum disease is it happens because of the tartar. So the tartar gets stuck under the gum line. Tartar is nothing but bacteria. So your body has been fighting the disease. Now all of a sudden it decides to give up. Now you got an infection under the gum line, which is going to cause the pain and the swelling that you have. So can that happen overnight? Absolutely, it can happen overnight. And one more thing that could happen is gum disease causes a lot of the gums to kind of peel away from the tooth. Sometimes when you eat, things get stuck under. What about if it is a corn that just got stuck under the gum line, you can't get it out? That is going to absolutely stay there because it's a foreign body. Now it is going to cause abscess. What if you smoke, right? And that kind of puts you at a higher risk also. So the variety of things can happen, and that's what we call it emergencies, right? So gum disease is going to suddenly blow up, suddenly cause an abscess or a pus pocket, then it is going to be swelling and it is going to cause pain. Yeah. And it can happen overnight.
Yeah, absolutely. That is true. Okay, so we'll do another live question before ending. Dr. Vadivel, I have a constant dull ache in a back molar. It doesn't seem to be a cavity, so what else could be causing the pain?
Constant dull ache in a back molar, of course, without seeing, I can't say whether it is a cavity or not. But whether the question would be is whether you are a constant grinder or whether what is your age. Because what happens is over a period of time, if you constantly, even like a regular wear and tear, like if you have like a lot of wear and tear, that can expose some of the nerve endings, and that can cause some dull ache. And if you had a crown and you may not have a cavity, but from the crown you may have some what we call it as a micro leakage under the crown that may cause the pain without you having a cavity. What if you grind your teeth? So if you constantly grind your teeth, the grinding that you do or clenching that you do, that can constantly put a lot of pressure on the tooth, and which is going to be translated onto the nerve. That can cause like a dull ache too. And bottom line is, go see the dentist, and they should be able to tell you what needs to be done. What is the cause for the dull ache? Sometimes gum disease too. Why did you not pick on me? What about gum disease? Right?
Dr. Shai only knows so much.
Okay, all right. So gum disease, the gum disease, like we talked about earlier, gum disease is a silent killer. So you may have gum disease, as sometime when you have the gums kind of like ache, you may be thinking that it is a toothache, but it's not actually a toothache, it is a gum pain. So once you treat the gum disease, things get better, Dr. Shai.
Very true.
Yeah.
Yeah, 100%. Okay, so that's all of our live questions for tonight, but continue to send them in. We may answer them on the next podcast. Why did my doctor say the implant was successful, but after 3 months it's failing?
How about you, Dr. Shai?
Yeah, why'd you lie, Dr. Vadivel?
How about you, Dr. Shai? What do you think?
Lifestyle habits, so people that smoke and drink, you're more inclined for your implants to fail. Which I know a lot of people that get implants and will just pay for debridements because they're not going to stop smoking. So lifestyle habits, I don't know, maybe the doctor.
Okay. So
I wasn't done. Wait.
Okay, all right.
An implant failing. Oh, it got infected.
Yeah. Okay.
The body's rejecting it.
Okay. What else?
That's it.
What
I think
about
I named
if they're wearing
everything.
a flipper? Yeah. What if they're they're not supposed to eat with the flipper that we give them, right? Or the tray that we give them, or a temporary crown.
Do people eat with those?
Sometimes, yeah, they forget they're not supposed to do stuff, right? Just
sure.
like you said, right? Sure. Smoking.
Right.
Yeah, they
drinking.
don't. Yeah, drinking. Yeah. Right.
The doctor.
So.
Infection.
Yeah, infection. So the answer is, why do the gums, why did I say on the first week when I saw them for a follow-up, implants look great, 3 months later the implant fails, right? So this is what typical, right? Can the implants fail? Is it 100% work? No, it's not going to work 100%, 99.99%. There is still a chance that the implants could fail. So the answer is, I tell my patients all the time, hey, I do the same thing over and over and over. I put the implant, I let it for the mother nature to heal the bone around you. Whether you smoke, you are at a higher risk. Whether you got infection, because of a variety of reasons, maybe a past history of periodontal disease, or you have some kind of a genetics, your risk is a little higher. So when those things happen, if the bone does not fuse around the implant, which usually takes about 6 to 8 weeks or up to 12 weeks, and if it does not fuse, then when we go back and when we try to put the crown, the implant kind of rotates. So let's say, for example, if the implant is like this and you have a complete bone fusion around the implant, so when I put my tool, the implant does not turn. Whereas if the bone does not fuse, then when I put my tool to put a new tooth on the top of that, which is a crown, the implant turns. And that's when I'm going to say, oops, sorry, your bone did not fuse. So who to blame? Mother Nature, whether it is because of the smoking or your medical condition like diabetes or any other medical condition, or it could be an infection, or it could be an unknown reason, which we say is sometimes bad luck, right? Could be, right? So it could happen too. So for a variety of reasons. So that's why we say first week or first couple of weeks, we say implant looks great. At the end of 6 weeks or 3 months, and we say, sorry, implant failed.
Do you know what us doctors call implants that move?
Oh, osseointegration. She's getting a little techie here. So
No,
the bone
a
fusion.
spinner.
A spinner. Okay,
Yeah,
got it. Yeah.
all right.
So
Okay.
what she's referring to is the bone fusion is called osseointegration. What Shai is referring to is implant kind of spun. So she called it as a spinner because the implant spins, which is not supposed to.
That's right.
Yeah.
That's what us doctors call it, not shy.
Okay. All right, Dr.
Please,
Shai.
thank you.
Yeah.
Okay, but I will say, as a doctor, there are just as many ways to help the implant integrate into the body system if there is issues.
Yeah, make sure that you're going to follow the instructions and not smoke and take the antibiotic and whatever the recommendation the doctor is giving you. If you have like a flipper or like you have a temporary crown on the implant, if the doctor recommends, do not smoke, do not use the flipper, do not chew on that tooth, just follow all the instructions and to avoid this from not fusing, the bone not fusing.
I meant like PRF, bone grafting, and laser.
You can possibly do those too. Yeah, man.
Yeah.
So tonight you are just there to.
Were you not here last podcast?
Okay, got it. Yeah.
Come on now, buddy. All right.
Shai is going wild tonight with all the extra
Knowledge.
the brain exploding here. Yeah.
Yeah, I've been doing this for some time now.
Mm-hmm.
All right. How does using mouthwash help with gum disease or prevent gingivitis?
So the bottom line is the two main things that the mouthwashes do are with reducing the bacteria. The second is building up a plaque, right? So that reduces the plaque formation, and a way we call in dentistry as a biofilm, right? And which is the cause of the inflammation or the gum disease. So the mouthwashes help you with reducing your plaque and minimizing your bacteria, and that's how they prevent like gingivitis or any other type of periodontal disease or controlling your periodontal disease.
Do you use mouthwash before or after?
Generally, we recommend you kind of like a tradition, right? People generally brush and brush their teeth, and then after that they immediately use the mouthwash. That's kind of a trend, because typically what we want you to do is after you brush your teeth, you wait for like a period of time, at least like about 20 or 30 minutes, and then we want you to use the mouthwash. Nobody is going to like stick to the recommendations. So I want them to use the mouthwash. So even if they cheat on after they brush their teeth and immediately they are going to use the mouthwash, go for it.
What's the difference?
The typical, well, what you don't want to do is like the alcohol, right? The alcohol, typically the mouthwashes contain certain amount of alcohol. So if you use the toothpaste and you're generally you're brushing your teeth, so there is a bit of abrasiveness. So when you do the tooth brushing and the teeth are kind of now, immediately you put alcohol, the teeth can become sensitive sooner because you're putting it like on an abraded. When you have those nerve endings that are exposed from the abrasion, now you put alcohol, the effect is going to be the damage from the alcohol is going to be higher.
Interesting.
On the tooth surface. Yeah.
Okay. Same thing for if the mouthwash doesn't have alcohol? Or do they all have alcohol?
Great question. Yeah. So, Dr. Shai again. So, for that reason, we recommend do not use a an alcohol-based mouthwash for a variety of reasons. One, the alcohol can give you dry mouth, and then number two, the alcohol, the same reason we say that it can just increase the sensitivity. And then number three, people have a lot of burning sensation in the mouth from the alcohol. So for those reasons, if you want to try maybe a non-alcohol mouthwash, just go for it. Yeah.
Well, Dr. Shai was going to say the same thing. The alcohol base gives you dry mouth and it makes your breath stink.
Yeah, because you have dry mouth. Now it's just going to make your breath stink. Yeah.
Okay. And before we wrap, you guys. Oh, and I use the TheraFlu.
Oh, you mean the
TheraBreath.
TheraBreath. Yeah, that's another. Yeah, TheraBreath, and then Biotin.
Oh, I haven't.
Biotin mouthwash. Yeah, what Shai is trying to say is there are some mouthwashes people exclusively use when they have a dry mouth. They do not have alcohol, but they kind of help you with that also, like TheraBreath.
I don't have dry mouth.
I
I was just recommending a non-alcohol mouthwash. I don't have dry mouth.
No, I'm not saying you.
Oh.
Yeah, I'm not saying you. So I'm saying if you are having a dry mouth.
Oh.
Yeah, okay.
Okay, he tried to put me in that category.
Okay, all right.
But there's other ones too you can get off of Amazon. The gum. I can't remember the brand.
Gum,
yeah.
Yeah. Well, any chewing gum is going to help, but remember, whenever people they think that it is going to help me with the dry mouth, but now they're going to end up chewing it with the TMJ problem.
Okay,
so
they're
yeah. So you want to do it fair. Yeah.
Well, we need patience.
You got.
They need to come in for something. Okay. Last question of the night, Doc. Can gum grafts be done for multiple teeth in one visit? Dr. Shai will do it. Yes.
The angle. Yeah.
Yes.
The answer is that's it. How many teeth we do in a day? You tell them.
We could do a whole mouth.
Bingo.
As long as we use cadaver, it depends.
Yeah.
Because if you use their own tissue, you're
Yeah,
limited.
so that's what people are going to generally ask, right? So, if I'm going to do a whole mouth, where are you going to get the tissue from, right? So they're going to ask, right? So we get it from the skin bank. So the answer is, people are being sedated when they are getting multiple teeth sites on gum grafting, and they don't want to be sedated multiple times to get gum grafting here and here. So it happened in our office yesterday, right? That patient had multiple teeth. Yeah.
Yep.
So the answer is yes. Yeah.
That's right.
All right. Thank you all for joining us tonight, and another great show. And we are really looking forward to joining you guys next month. And until next time, take care.